Well, let's just first start with some of what's happening globally, and I suppose we want to focus in on the regions that you're responsible for, and that would be Eastern and Southern Africa. Talk to us about the progress that they've made, particularly with its 10 targets of the HLM political declaration.
I think what the report clearly shows is that, in fact, there has been a lot of progress across some of the key targets, although a lot still need to be done. As you recall, in fact, next week the world is converging to Washington at the International AIDS Conference, which is one of the most important calendar event in the AIDS response. And clearly, the report that UNAIDS has released actually is building up the momentum to that meeting, which clearly would show that, in fact, there's going to be a lot of spotlight on what we have achieved, what we have not achieved, and what is it that we need to do. But in terms of progress, I think it's very clear that we continue to see a decline in new infections across the world. Although those infections still remain quite high. But across the African continent, for instance, we are talking about, in fact, most of the most affected country, realizing, major decline in new infections. In terms of treatment, it's very clear again that, in fact, for the first time, we have, more than half the number of people who need to be on treatment who are currently on treatment. And precisely, we are talking about 8 million people who are currently on treatment. And for sub-Saharan Africa, we're talking about 6.2 million people.
So here's what's concerning, is that the countries that have been cited have had the most dramatic progress: South Africa, Botswana, and Zimbabwe. But then if you just look at South Africa's numbers, I mean, the estimates right now are that by 2015, we're probably looking at 5.5 million orphans in the country. And I would imagine that the HIV and AIDS pandemic being the driver of those orphans and that estimation. And I was just looking for a country, if we were to say to people 5.5 million, that's a country, we're talking about the entire population of Denmark that we're looking are in a couple of years who are not going to have their parents. So when we talk about how we're going to be able to deal with that as a country, what are the plans?
I mean, the plans are very clear, at least for most of the countries. Most of the countries have clearly begun to realign their national strategic plans to the political declaration, to the HLM targets that we talked about going to 2015. So for South Africa, I think they have clearly stated out in their national strategic plan that they would want to have reached 80% of people who need to be on treatment by 2016. And if you look at the progress to date, yes, everybody agrees this is the largest epidemic on earth in South Africa, but the progress is quite big. In fact, Eastern Southern Africa has probably about 5.4% of the global population and have the global burden of HIV. Mm-hmm. So in fact, I think if there's a region that needs to push us towards those targets, it is going to be Eastern Southern Africa, but particularly Southern Africa.
What has a country like Malawi done? Because Malawi, they were, their infection rates were absolutely astronomical. The number of people that were infected with the virus were really, really high. But it seems as though the government there seemed to turn that around. What did they do right?
I think most countries where we have seen a major decline in new infections, those major declines have happened among young people across the board. So it's the same as Malawi. And there have really been three major issues that have happened with young people. One, change in the number of sexual partners. Second, the delay in initiating sexual activities and the use of condoms.
But I want to ask about that, because in South Africa, I don't know about Malawi and other countries, but just from the news flow that we get in South Africa of how much younger and younger people, we're talking about 8 and 9, that are already sexually active in this country.
I think the direction is to make sure that, in fact, young people actually have the life skills that help them to protect themselves against this epidemic. But again, we should note that this epidemic is also is a mirror of the social inequalities that we have in societies. Some of the young people that are most vulnerable are those that come from poor backgrounds. But also, I think, in general, what we need to do is to see what we can do within the education system to make sure that, in fact, kids have life skills that helps them to actually deal with the issues of vulnerability around HIV infection.
Let's talk about treatment and food and nutrition. On the African continent, it's very difficult for us to not talk about how nutrition comes into play, because you do have, you know, and even in the region that you're talking about, not nutrition a very, very big part of you taking care of yourself. If somebody is HIV positive, not only should they be getting their ARVs when they need to, but the side of nutrition also plays a role. So in terms of what is being done to ensure that people are not only getting treatment in terms of medication, but also that nutrition is provided or is made easily accessible for the people that need it, that are infected.
Certainly, I think you're absolutely right. Nutrition is a major component, in fact, of the treatment program. What we are talking about is a whole comprehensive approach towards treatment. It's not just about drugs. It's also just about total, well-being of people that needs to be taking these drugs. And in fact, I think if you look across the continent, in fact, most of the social response programs around people who are on treatment is also just to make sure that actually they have access to nutrition and also to food security, to make sure that actually they can actually be able to augment, Is that really happening though? Because we hear that, yes, there are efforts that are being made, but is that actually happening on the ground? Are people getting that kind of support? Certainly in most countries they do. In fact, I think there are a number of countries that we can cite where, in fact, if you take a country like Botswana, for instance, I think they do have, alongside, particularly if you're talking about orphans, they do have a package for orphans, just to make sure that there is adequate nutrition. Take South Africa. South Africa is one of the most comprehensive child support system, again, which makes sure that kids do have access to to nutrition, and some of the households that are vulnerable. Some of the issues that have been raised to deal with this, gender inequalities, you've mentioned that, but I also saw that the report was talking about punitive laws. What would you like to see in that space? When you say punitive laws, what does that mean? I think the report, for the first time, head-on tackles the issue of social transformation. And essentially what it means is that, in fact, what we would like to see is that we would like everybody who needs to have access to services to have access to services without any legal barriers, whether the barrier related to their sexual orientation or to some other form of social exclusion. So the report is very clear that I think what you need to do, we need to have an environment that is supportive of people being able to take HIV tests so that they can know their status, that they can go on treatment early, and so that, in fact, there's no discrimination on whatever grounds whatsoever. In fact, if you look at what has happened in a number of countries across the region, in fact, I think there's quite some movement in trying to make sure that, in fact, there's no social exclusion around this epidemic, because social exclusion is actually fueling the epidemic. And let's face it, in fact, the epidemic in key populations is the same epidemic. It interacts with the epidemic in the general population because of the stigma and discrimination that people suffer. Thank you so much for joining us, Dr. Mugabe.